Predictive modeling, how multimorbidity can be used to screen for diabetes using SQL by Sherita Edwards. Voice narration by Sherita Edwards. This presentation was prepared for HAP 709 for the Masters in Science in Health Informatics program at George Mason University. Diabetes mellitus has a profound effect on U.S. health and healthcare costs. It is one of the most common chronic diseases in the United States, with those diagnosed suffering a great deal of disability and mortality. The estimated cost of diabetes management in 2017 was $327 billion in the U.S. alone. Nearly 23.1 million patients are diagnosed with diabetes. An estimated 7.2 million people go undiagnosed. Early diagnosis and effective management of diabetes improves the morbidity and mortality outcomes and has the potential to save millions of dollars in healthcare costs. The use of big data, such as produced by electronic health records, can be used to develop predictive analysis to identify those patients who are at risk for developing diabetes. For this presentation, a database with simulated patient information from a major healthcare institution in the United States was used. There were approximately a little over 17 million records used and a total of 829,827 unique patients used for this project. In order to create a predictive model for diabetes, the ICD-9 code for diabetes has to be defined in SQL. This slide is an example of the SQL code used to define diabetes. A comprehensive set of diagnoses were used to predict the presence of diabetes or risk for diabetes. This slide shows an example of the SQL code used to determine the diagnoses for which there were 29 observations. The total number of that was 8,250. This image is taken from the website icd9data.com. These diagnoses are examples of obvious predictors of diabetes because there is the word diabetes in the diagnoses. These kind of obvious predictors were not used as in the SQL code for defining diabetes because they are obvious predictors. This slide shows examples of rare diseases that were predictive of diabetes and their corresponding likelihood ratios. These predictors were not as obvious as those predictors with diabetes in the name. Some of these ICD-9 codes represent eating disorders, endometrial hyperplasia, menopause, and osteoarthritis, to name a few. This is the naive Bayes formula. The naive Bayes formula states that probability of being alive given a diagnosis, also known as posterior probability, can be calculated using the likelihood of observing the diagnosis among alive patients. The naive Bayes formula was used to aggregate data from individual diagnoses to predict the overall risk for diabetes. This slide is an example of the SQL code for Bayes of the Bayes formula. The naive Bayes formula was used to aggregate data from individual diagnoses to predict the overall risk for diabetes. This slide is a representation of the naive Bayes formula in SQL. This code was used to determine the likelihood ratios for the diagnoses. Once a likelihood ratio has been calculated for the diagnoses, those likelihood ratios can be incorporated into this SQL code that is present on this slide to determine the odds and probability of diabetes. This is an example of how likelihood ratios can be used in predictive medicine. This slide presents diagnoses with their corresponding odds and probability in SQL. This slide occurs as a result from the code presented in the previous two slides. Dr. Alemi defines the process of cross-validation as randomly setting aside data for the purpose of checking the validity of the model. This slide represents the SQL code for splitting your data into a training set, including 80% of your data, and a validation set that includes 20% of your data. The receiver operator curve can be used to test the accuracy of our predictive model used in SQL. This slide represents a receiver operating curve, and it shows the relationship between sensitivity and specificity. For example, a decrease in sensitivity results in an increase in specificity. Test accuracy is the area under the curve. The larger that curve, the more accurate the test. In conclusion, predictive analysis can be used on big data generated by electronic health records to predict morbidity and mortality outcomes.